Good afternoon, everyone. Happy Wednesday and happy September. We're just going to go ahead and jump into it. We do have a very full schedule, so we're going to go ahead and jump into the agenda. So we're going to go over announcements. We have a little bit to talk about with Not Alone. We also have a epi update. Then we'll hear from our friends over at Oral Health, Teen Pregnancy Prevention, and also our community health and food safety folks as well. So let's just go ahead and jump in. So a couple announcements. As you know, for the longest time, the school health updates have been predominantly focused on um, health, physical health. And so for a long time, these started because of the pandemic, and moving forward, now that we are no longer in that spot, we're now approaching a different type of health aspect and be more well-rounded. So we're going to be including a mental health aspect moving forward with these calls, as well as the physical health still. So we're going to be expanding invitations to counselors and social workers out in the schools. So there'll be more to come on that. But for now, we're just going to keep it as is. so, so as you all know, these calls are also hosted by the Pima County Youth and Schools program. And part of the program is that we have what's called the You're Not Alone initiative. We're in our third year now in this initiative, and we're still committed to equitable um, and reduce barriers to mental health services. With the health department has teamed up with La Frontera to offer 5 free therapy sessions to youth across Pima County. Uh, Essentially, the eligibility is they need to be 24 or under, they must live in Pima County, and if they are 17 or younger, they must have prior consent provided by their parents or guardians of the before they accept the sessions. And you can also click on the links. The links are clickable on this as well. Um, and then this is just a little bit of this is a screenshot of what it will look like. We offer therapy sessions. We also offer suicide prevention resources, the Be There certificate, which essentially is for youth if they're trying to learn how to be there more for their friends. And then we also have support for school and parents. So for school staff and parents, which is a super awesome resource. Again, if you're interested in, we will also drop a link later on in the chat for you guys to just click around. With that being said, I'm going to pass it over to Epi. Alex, are you on? I mean, Jake, are you on?
Good afternoon, everybody. My name is Jake Alexander. I'll be presenting the respiratory update for EPI. And next slide, please. So it should be a pretty short update. So that's good. So currently we are in week 34 of the 24 to 25 respiratory season, which goes from October 2024 to September 25. In the current respiratory season, we've had 1,442 confirmed cases, which is 55% more than usual. If you take a look at the figure, you can see the dotted line shows the previous respiratory season, where the bold line shows the 5-season average from that point in time. And then the bars are the counts for the current year. So as you can see, we've actually had sort of the same trend, but it occurred later in the year, which is interesting, but it's something that can certainly happen. We don't really have a huge reason for why. As we are leaving summer now and heading into the beginning of respiratory season, we would expect to see these case counts start to go up. But the reason I highlighted this shift in timing from last year, or from this current ending respiratory season, is that we aren't 100% sure if it's going to follow the pattern of previous years or of this past season. Next slide, please. Over here we have our influenza seasonal report. As you can see, the current 24 to 25 season followed the general trend. However, we did have a very high and active flu season. So in the current flu flu season, we had 7,398 confirmed cases, which is 144% more than usual. So just something to keep in mind. As always, we recommend that if any students are sick, that they be sent home and isolated until they're feeling better. With essentially all respiratory diseases, that's going to be the best way that you have to prevent spread, um, apart from, other methods that we've talked about in the past. Next slide, please. And then finally, we have our COVID-19 seasonal report. So as always, I will explain for anybody who is new, the reason that the figure looks sort of squished at the top and larger at the bottom is because in previous years, we had so many COVID cases that it caused the four-season average to be so high that you would not actually be able to tell the difference between case counts in the current season. So if you can imagine it, this figure, if it was to scale, would actually be 5 times as large, or a little less than that, about 3.5 to 4 times as large. But because we haven't seen case counts for COVID increasing anywhere near they were in the past, we decided to sort of append that top part and make it so it's a little bit easier to see what the COVID case on a week-to-week basis for the current respiratory season looks like. So in the current COVID season, we've had 10,144 confirmed cases, which is 85% less than we have seen in the past. As you can see, we're actually already starting to ramp up in our COVID case counts. Normally there's like a summer lull with a small summer spike, which you didn't really see this year. There's a tiny little bump from week 17 to 18, but that's, nothing huge. But as you can see, there's like a very visible ramping up that's going from week 24 and now to week 33 and 34. So again, something to keep in mind. As we start to head into the fall and winter months, we do expect to see those case counts start to rise. Next slide, please. And then over here, we just have the 3 respiratory diseases plotted on top of each other, just for your visual understanding. As you can see, flu and RSV are both very low. Only 8 flu and 3 RSV cases. But as you can see, COVID has really started to elevate in comparison, where there were 226 cases in this past week. And I believe that's it for Epi. Does anybody have any questions? All right, thank you very much. In case anyone does think of any, I actually have to hop to another meeting, but I will put my email address in the chat, and if you have any questions, you can just send me an email. Thank you very much.
Thank you so much, Jacob. Now, next we have Margaret Perry with Oral Health. Margaret, are you on the call?
I am. Let me try to get my camera here. There we are. Good afternoon, everybody. My name is Margaret Perry, and I'm the program manager for oral health with Pima County Health Department. I'm here to talk to you a little bit about our program, the dental sealant program that many of you probably know about, but we do have some review and new information for you. If we can go to the next slide, Chris, please. We want to first start with what are dental sealants. These are a special coating that we paint on the back teeth. It can actually prevent 80% of cavities on those molars where 9 out of 10 cavities occur. So at the top, you can see a permanent molar. It may be the first permanent molar on a second grade, or it could be second permanent molar on sixth grade children. But you can see the grooves, the cracks, the crevices. This is where the food and bacteria get stuck in the tooth and really set up cavities in those back molars. A lot of kids don't know that they have these permanent molars, actually kids and parents, because they don't lose teeth before these molars come in. Unlike in the front, right? When they get their new adult teeth in front, they have loose teeth. It's a big event. They put the tooth under their pillow for the tooth fairy. So it's very different. They don't know that these new molars have come in. And like I said, this happens during second grade on average, second grade, and then sixth grade. So that's why we target those particular grades. The picture on the bottom is a tooth with a sealant. So we clean the tooth, we wash, dry a couple of times, and then paint this plastic coating over the top of the tooth. And the intent is that it seals the bacteria out. So once we've removed and cleaned that tooth, we can put the coating on, and that will protect the tooth from additional food and bacteria getting stuck in those little cracks and crevices there. It's a very simple process. I tell the girls it's kind of like getting your fingernails painted, right? You wash your hands, you dry them, you paint them with the nail polish, and then the nails are a little bit harder and shiny. Um, the protection can actually last for many years. The goal is to get them through those cavity prone years, which is well into high school, but we've seen sealants last 20 and 30 years. So again, the goal is to get them through the toughest times, but it can protect for many years past that. It's a cost-effective way to prevent tooth decay. You probably all know about fluoride. That's another way that we can prevent cavities, but it doesn't help in these rugged surfaces, if you will. Fluoride will help on the sides of the teeth where it's smooth, but it doesn't help in these pits and fissures. So both are actually recommended interventions to help prevent cavities. We can go on to the next slide, please. So the school-based sealant programs, and they are around the country. We are not the only one doing this. We are the only one in Pima County doing this evidence-based school-based sealant program. And like I said, we target second and sixth graders because that's when the new molars are coming in. Second graders could have 4 permanent molars, and sixth graders could have 8 permanent molars that would benefit from sealants. And the studies definitely show a significant reduction in cavities among children who get these sealants. Again, 80% less likely to develop cavities in the molars. Healthy teeth, as we know, also contribute to better school performance, as kids with fewer dental issues tend to miss fewer days of school. Sealants are cost effective, and they help to reduce the need for more expensive dental treatments in the future. We all like to save money, need to save money, and like to save money. Most importantly, our grant-funded sealant program is designed to serve students who are uninsured or underinsured. Those children often face, and families face, barriers to accessing preventive dental care. So it opens the door for a lot of families in the schools that you all are at. We target schools that are 50% or greater free and reduced lunch. And this year we actually had more schools that qualified for that. So there is a greater need out there. And go on to the next slide, please. So the most recent survey shows that 63% of third graders in Arizona have some form of tooth decay, and 24% of them have untreated tooth decay. That means holes in their teeth that haven't been taken care of, and they will only get bigger and cause more problems. Decay does not often stop. It can, but not often. More often, it just continues to grow and cause more problems. If you have decay on one tooth, obviously you have a bunch of bacteria there. The bacteria is being fed. It's very easy for decay to happen on the tooth next to it or the tooth next to that. So it really sets up an environment that is difficult to maintain once it gets set up like that. Lastly, 77% of the students would benefit from dental sealants. So they've gone in and looked at, in this case, third graders, and 77% could use dental sealants but didn't have them. So there's a huge unmet need out there, and that's what we're trying to fill, is to help that specific age group improve dental care and prevent problems in the kids. Next slide, please. So that's the why, and now the how. There are over 151 schools that are eligible to participate. We have about 75 that have already applied to participate. Eligible schools just complete a simple application. The school contact person helps us schedule a date to provide education and distribute the consents. And then we schedule a date for the RV and our team to provide the free services. The success of a program is impacted by the support it receives from its partners. And we want to thank all of you, the school health staff and administration, for supporting this prevention and early intervention program. ADHS, or Arizona Department of Health Services, began the program in 1987 and continues to administer the program across the state. Pima County Health Department has been implementing it since 2004. So we have been to just about every school, I think. Certainly every school, 50% or greater free and reduced lunch, and been able to help many, many children over all those years. Okay, next slide. So health literacy is also a component of our education. We really want to help the kids learn to make important health decisions for healthy lives. This past year, our education presentation was updated. The curriculum was developed by educators in conjunction with the Arizona Department of Health Services. And the presentation remains a 20 to 25 minute session. There is, again, the new format. We address some of the health standards, language arts standards. Second graders get to see a short video, a story. That little coloring book there with the tooth on it is given to them and read to them. And they get to take it home, color it. There's some questions and answers in it and a little maze that helps keep the kids entertained. Sixth graders, we have a video and then the infographic that you see there. Again, helping them to learn how to interpret data, statistics, and specifically in this case, benefits of dental sealants. Again, we review the questions and answers with them and encourage them to take that information home and teach their parents sometimes that may not know about sealants and the true benefits of it. Okay, next slide. So in addition to providing that education, this is where we provide the free preventive services. It includes an oral screening to see what's going on in the child's mouth, and then to identify any areas of decay, any cavities, and specifically for this program to see which teeth, which of those permanent adult molars would benefit from sealants, and then apply them right then and there at the school. Backing up just a little bit, on the day of the presentation, each student will get this consent packet. Comes in English and Spanish. The first page that you see here is some general information about sealants for the parents, and then the consent form is attached to that. So the children, again, are encouraged to take that home to their parents, have them complete it, fill it out, sign it. I think it was just this last year, maybe a year and a half now, we're trying to do more of the digital consents. And so we have a QR code that is actually on this paper. It doesn't show here, but it's given out to them and even emailed to parents to encourage them to fill out a consent form on their phone, tablet, or computer. They don't even really have to do the paper copy. They have two options then, paper copy or doing it online. And the online ones are picking up a little bit. It was a slow start to begin with, but I think because so many of your schools now are requiring online registration and communication, more parents are feeling more comfortable using that. So that makes it a little bit easier for everybody. Next slide, please. So once the slides, once the consents have been collected, we return with our mobile dental unit. We bring the children out to the mobile RV. And as you can imagine, we see lots of things out there. First and foremost are those priceless smiles, and truly the reason we do what we do. We're also looking at their gums. Are they healthy? If not, maybe they're not able to brush regularly. Do they have a toothbrush? Do they know they're supposed to be brushing morning and night? A lot of times kids will say they brush in the morning, but they don't do it at night. So we try to encourage that as well. We're looking for areas of decay. Um, some that are just starting and some that may even be causing eating problems, chewing problems, or even pain. And we know if they're not able to eat well, sleep well, they're not going to be able to learn well either. We also look to see, are there permanent or adult teeth coming in as expected? Are the molars healthy? Would that child benefit from the dental sealants? Again, dental sealants help in lowering the risk of dental decay and cavities in their adult molars specifically. So when the screening is completed, each child takes home a quote report card so that parents know what we saw in the child's mouth. They also get a community dental list and resource sheet for the parents. So if they need to find a dental home, they have some resources to do that. Unfortunately, this last year, we identified over 39 children with urgent dental needs. That means they either complained of pain when they were eating, drinking, sleeping, they had an infection in their mouth. They may have had a swelling, most likely due to that infection, or some bleeding that was not, well, bleeding is never normal, or bleeding is never healthy. Sometimes, unfortunately, it might be semi-normal. But anything out of that ordinary, we send a note home to the parents. And within, 24, 48 hours, we contact the parents because it's that serious that if they have this infection or pain in their mouth, we know it affects their quality of life and probably their school as well. So after each clinic, we provide the health staff with a list of children with the urgent needs. Like I said, we try to contact the parent or guardian. And sometimes we ask the assistance of the health staff because we think, but we've been told otherwise too, that we thought maybe parents would be more likely to pick up the phone if it was a call from the child's school. But that's not always the case too, unfortunately. If we can reach them, we assist the families with connecting them to a community dental clinic, or sometimes it's just reinforcing them the information that access or their kids care plan doesn't require a referral and that it covers most dental treatment for children. Parents often know access is good for medical, but they don't always get the dental piece. So sometimes it's that simple education. Oh, no, you do have access. It does cover dental. You can take your child to a dentist and have the services covered. So connecting with these families, it allows us to hear about their concerns, their fears, and we oftentimes can get into just some discussion with the oral health habits of the kids to help those parents reinforce what they know needs to be done. And thanks to a grant from Delta Dental Foundation of Arizona this last year and a half, we've been able to provide each child that returns a consent form with a spin brush. And next slide, please. And it comes in a variety, oh, maybe one more. There you go. A variety of characters. And as you can imagine, this really ignites the children's, even sixth graders, but they get very excited about that. I'm unfortunate, I don't think we're going to be having them maybe next semester because the funding has gone away and I'm just not sure how long these spin brushes are going to last. So if you haven't got your application in and you haven't signed up for the education yet, get her done so we can get in there and the kids can have this, get to pick their spin brush. It really does make brushing easier for the kids and the parents alike. Next slide, please. Okay, so I just wanted to take a moment to highlight the importance of offering both our grant-funded dental sealant program and the for-profit dental program that some of the schools have available to them. The grant-funded program is an evidence-based program specifically designed to serve students who are uninsured or underinsured. Okay? And this way we can ensure that they receive vital preventive dental care. They just need to fill out that consent form and we bring it right to the school. On the other hand, the for-profit program is convenient for students who already have dental insurance. But we know the majority, well, we know many, a significant number of families do not have dental insurance. Even those that do have it may not utilize it because they don't know how to find their dentist or find somebody that fits under their insurance plan. So each program actually addresses a different need within your school community. By offering both, we feel that we can ensure that all students, regardless of their insurance status, have access to essential oral health services. This approach promotes equity and helps us better support the health and well-being of every child, not just those with insurance or those without. So together we want to help make a difference. Next slide, please. So we partner with schools to support the good oral health. We provide posters to promote the program. We implemented the QR code. We do the educational presentations. We've asked teachers and school staff to assist us. They send home a parent reminder email, check the backpack, get your consents in. We will remain flexible, working with the principals and teachers and health staff to schedule our visits, education, and clinics. We understand there's a lot going on in schools these days, and the fact that this only takes about 15 minutes per child to put the sealants on is an easy strategy to help prevent cavities. They don't have to take a whole day off, or their parents don't have to take off work to go to the dentist to have these very simple preventive things. Now, if a child needed fillings and crowns and things like that, they will have to take probably a day off of school to go and get that done. You want the parent really present when that kind of service is happening. The sealant process is so simple. Parents are welcome, but there really isn't the same need. It's not like getting an immunization or anything like that. There's no shots, no drills, no anesthesia. It's simply cleaning and painting the teeth. So our passion and focus after 20 years remains. We're trying to improve the access to care and lower the risk of dental care and our most dental lower the risk, of dental decay in our most vulnerable populations. We do that through the promotion of fluoridated toothpaste, fluoride treatments, and dental sealants. None of this we could do without ADHS and the collaboration with our community stakeholders. So your schools and your dedicated staff, and of course our community health centers, we thank you for all that you do and all that we will help you continue to do. And I think that might be it. Yes. So thank you. If you have any questions, our number's up there. Many of you have probably already been contacted by Andrea. She's our program coordinator and registered dental hygienist, and she is remarkable. She will work with you as much as you need to get this into the schools and get those children served. So again, appreciate it. Thank you for the time, and we look forward to seeing you at school.
Thank you so much, Margaret. I appreciate that.
Yeah, thank you.
So next we have Ana Guerrero with the Teen Pregnancy Prevention Program. Ana, are you on?
Yes, hello everyone. So I'm Ana Guerrero and I am with the Teen Pregnancy Prevention Program. Next slide. So with the Teen Pregnancy Prevention Program, we provide abstinence plus education to youth 12 to 18 using our Making Proud Choices curriculum. Making Proud Choices is an 8-module curriculum. We provide also an adulthood preparation subject PowerPoint, which focuses on adolescent development, which is focused on physical changes, cognitive changes, as well as gender identity and the importance of pronouns. Next. Making proud choices gives the youth the tools and knowledge, as well as the attitudes and skills to reduce the risk of unintended pregnancies, STDs, and HIV. This is an evidence-based curriculum that uses discussions, DVDs, games, demonstrations, including a condom demonstration and role play. One important information I will address is that anyone under the age of 18 participating in this curriculum does need to have a parental consent. And then again, the program is just to help get the correct and reliable knowledge and information about risk and diseases, as well as developing an attitude that supports safer decision making, builds skills to be able to abstain from sex, as that is our important role in this, but to use latex condoms if they choose to have sex, and then build confidence in the ability to abstain from sex and having the practice skills needed to be safer. Next slide. With our teen pregnancy prevention program, we are just rolling out a new curriculum, which is also called Positive Potential. Positive Potential is for ages 11 to 13 using the Positive Potential curriculum. So this curriculum is tailored for only middle school students, grade 6 to 8th grade. Again, a parental consent is needed as this is an abstinent education. Again, we are encompassing a wide variety of subjects such as bullying, self-confidence, risky behaviors that really relate into the students' needs as they grow and mature through their adolescence ages. 8th grade, there is a additional subject. So with our 8th grade curriculum, there is a suicide lesson that is optional. If we were to add this into our 8th grade curriculum, it would then add an extra module, which would give us a total of 6 with this one. Next slide. So again, I am Ana Guerrero. I am the program coordinator for the teen pregnancy prevention. We have Sandy Nguyen, who is our program specialist, who also facilitates classes with me. And then we have our public health nurse manager, who is our supervisor, Jessica Dalton. If you guys have any questions or would like to set up a meeting for a possible collaboration, you can reach one of us at any of these contact information. Does anyone have any questions?
I don't see any right now, but there's also time at the end for anyone if there are questions.
Okay, perfect. Thanks
so
you.
much, Anna. I appreciate you. So next we have pool safety with Logan. Logan, are you on the call?
Hello. Hi, so my name is Logan, and I'm with the Consumer Health and Food Safety's Aquatics Division. And today I will be going over pool safety in Pima County. So, for those of you who aren't aware, Pima County has over 2,500 permitted bodies of water. This is everything from swimming pools to hot tubs to cold plunges, and all of those specific permitted bodies of water are inspected once a year. Residential pools, so your typical backyard pool, does not get regulated by Consumer Health and Food Safety, and only public pools are required to have lifeguards. So this is just a little bit of a picture of what pools look like here in Pima County. And for those pools that do require lifeguards, there's supposed to be at least one lifeguard per 25 people that's in the pool. To regulate all of these bodies of water, we do uphold the Arizona Administrative Code, Title 18 and 9, as well as Pima County Code 8.32, and then we really work hard to uphold the Virginia Graham Baker Pool and Spa Safety Act. Next slide, please. And so, looking at pediatric drowning here in Arizona and in Pima County, I wanted to highlight this very specifically. It is silent and it is 100% preventable. The two greatest ways to prevent pediatric drowning is to have competent and safe adult supervision of the swimmers, as well as ensuring that swimmers do know how to swim and are given access to swim lessons. Drowning happens even when lifeguards are on duty. This is because drowning is silent. In most cases, when somebody is going to drown, they don't splash, they don't kick. It happens very quiet and it happens unseen. So, It is essential that parents and guardians of kids are watching them, even if there are lifeguards on duty. This way, we can always ensure that somebody has an eye on these children. And finally, learning to swim is the only true way to really protect against drowning. It allows people to be able to save themselves and not have to rely on others in the event of them not being seen. Next slide, please. Some of the big things that we look for when it actually comes to help alleviate some of these concerns are things like barriers. When we do routine inspections on pools, something like an apartment pool, an HOA, neighborhood pools, the pool gate has to be at least 5 feet high and they can't have any gaps greater than 4 inches. As you can see in these sort of images, it's very easy for kids to get under gaps. 4 inches is roughly the size that it would take for a kid to get their head through the gap in a barrier. And if they can get their head through, they can get the rest of themselves through. And so we want to make sure that there's no gaps, whether that's things like chain link or just reducing the size. And any gate that there is on a pool needs to be able to close and latch itself on its own. That way no kid can wander up and push a gate open and fall in the pool. Next slide, please. As I mentioned earlier, we work really hard to uphold the Virginia Graham-Baker pool laws, and that's really focused on anti-entrapment devices. Things like drains, which are a hidden danger that most people don't consider when they go to a swimming pool. The big concern with drains and the reason that the VGBA, Virginia Graham-Baker Pool Law, came into existence was because of entrapment tragedies, where people can get stuck to a pool drain and then not be able to swim back up. So, always making sure to pay attention to the drain before people get in the pool, making sure that there aren't cracks or even missing screws if you can see them. Before even getting in the water is one of the easiest ways to make sure that there's not that risk. Additionally, it's never recommended for anybody to actually lay on a pool drain just out of the pure risk. Next slide, please. Another thing that we typically see in and around pools are floaties. For little kids who don't quite know how to swim yet, or just somebody who's not fully confident, the only real safe flotation device is a properly fitted Coast Guard approved life jacket. Floaties, they look nice, they're fun. They can sometimes become dislodged. They'll slip off arms and they'll strand their user. And if they don't already know how to swim, but may have gone a little bit too far because they had the safety net of the floaties, they could be in a little bit more danger than they would otherwise. Additionally, no floaty or life jacket can truly compare to learning how to swim. Just going back to the two greatest ways of prevention is still paying attention to kids that are in the water to make sure that floaties aren't becoming dislodged and making sure that the children know how to swim. Even if something did come dislodged, they could make their way to a wall or a safe space. Next slide, please. Also, very, very much into the whole two greatest ways to prevent is water watchers. For every child that is swimming, there needs to be a designated adult watching them, especially children who don't know how to swim. That takes an extra precedence where for every child that does not know how to swim, there needs to be one set of eyes per child. That means for families that have two children that don't know how to swim, there need to be at least two adults watching those children to ensure that they are in a safe situation. The watcher should not be distracted by phone, and they should not engage in activities that could delay the reaction times. Things like alcoholic substances that could slow reaction times that are critical to saving lives. Additionally, we know that it's a big responsibility to keep an eye on these children the entire time that they're in the water. So shifting the watchers routinely can help alleviate some of that strain so they don't become tired or distracted. just that way that they can actually truly engage and make sure that their kids are safe. Next slide, please. To benefit this and how we're trying to actually enforce this is we've been working with a few different grants now, one through the CDC and one through the Consumer Product Safety Commission, to be able to offer free or no cost lessons to people ages 6 months and up. So not even just children, to adults that may need to learn how to swim as well. Our current two groups that are really working with us are the YMCA and then some of our tribal partners, but we're trying to expand this to work with additional groups so we can expand swim lessons all across Pima County so that anyone who would like to learn how to swim can do so. Next slide, please. With this, I've actually included some of the sign-up instructions here. This is through the YMCA, and it's for any individuals who are ages 6 months and up, where they are able to get signed up, go to any YMCA branch that has a pool, and be able to receive, I believe it is 4 free swim lessons, just using the code Pima Swim. Next slide, please. We are beginning the process of a grant with some of our tribal partners as well that will allow us to them to transport children from schools to be able to go receive swim lessons. They'll be able to use the school bus, and school-age children will be able to then benefit from swim lessons, and we will be able to cover the cost of what the parents and these children would normally be paying. That way that we're able to expand swim lessons and ensure that we're truly achieving our two greatest ways to prevent drowning. I've got a few handouts that I can provide. I believe I've already sent some of them out to some of you, so you might see some of these, including our Water Watcher cards. I can provide you the PDF of it, but if you want more of these or want physical copies, please feel free to reach out. I'll also provide my contact and we can get you some physical copies of some of these things.
Awesome. Does anyone have any questions either for Logan or Anna or Margaret? At this time, I know you can't take yourself off mute, but you can put your questions into the chat. Seeing none, I'm going to go ahead and just move us along to the end. So if you do want to contact us, of course, you can always call us at 520-724-7018 or email us at schoolsupport@pima.gov. With that being said, that is the September school health update. Be sure to be on the next one, which will be on October 1st. So thank you so much, and I hope you all have a wonderful Wednesday and a great rest of your week.